I mean, the pharmacist is definitely right there on the front lines when they are filling them, so we always have concerns of medication errors regardless of the medications, but where we probably see a lot more is where adequate medication reconciliation hasn't been done, regardless of where in the arena the reconciliation wasn't done or done to the fullest with the patient's input in it. So I think if we can kind of make sure we are asking those questions of the patients, you know, their label might say one particular insulin dose, but because their doctor or their endocrinologist or their nurse practitioner or even their clinical pharmacist may have given them the recommendations on paper to say, okay, well, if this particular hypoglycemic reaction occurs or number occurs on your meter, then go ahead and dose reduce, or maybe they've been told to titrate upwards. So I think just making sure all of us know exactly the dose that they're taking. The other thing is there are some new, more concentrated insulins with U200s, U300, and of course U500, where medication errors typically can occur. We've had the most experience with the U500 as it is 5 times more intense than the U100. The newer ones, such as the U200 insulin as well as the U300 insulin, it's nice that they both come in pen form, so that can eliminate a lot of the errors possibly. However, we do have patients that, because they've just been transitioned from the syringe over to the pen, and then for some reason they don't have their needle heads anymore for the pens, they've ran out of that, but they know they have extra insulin in those pens, and then so at their old U100 formulation, they would just go ahead and pull with their old syringe the insulin out of a U100 pen and have no problem. So I think that it's very important to make sure that the pharmacists educate them on these new products that are coming out. They're more concentrated, and thankfully they're in pen form, but to make sure that they know that they cannot do that, especially since the patients may not have the experience or know-how to how to appropriately adjust those insulins. So I think communication, knowing what they're doing, and then just make sure you're giving them the proper education, I think can eliminate that as well.